Hello everyone. On behalf of ANROWS, I would like to welcome you to our webinar, Evaluation in the Violence Against Women sector. My name is Michele Robinson and I am the Director of Evidence to Action at ANROWS. I acknowledge the traditional owners of the land across Australia on which we meet today, and on behalf of ANROWS, pay our respects to elders past, present and emerging. Wherever we are today, we are on unceded Aboriginal and Torres Strait Islander land, and I acknowledge and pay respect to Aboriginal and Torres Strait Islanders who are participating in the webinar with us today. Today is a panel as per our usual format, followed by a live Q&A. Evaluation. Now, evaluation is a standard requirement for most community-based government-funded programs and projects across the violence against women sector. Evaluation provides an opportunity to document outcomes and the effectiveness of practice and programs, support future practice and program development, and support future and ongoing funding proposals. However, evaluation is complex, and for organisations in the violence against women sector, managing various risks, safety and ethical issues come to mind. Today, we will hear from the panel about their insights on conducting evaluations in this sector. I would like to introduce the panel, who you can see on the screen. Annika Kearton is the Acting CEO of ARC Justice. Cecilia Hemana is the Director for Research and Evaluation at Respect Victoria. Roddy Blay, who has appeared on the program previously, is an independent trainer, policy advisor, researcher, supervisor in the domestic and family violence sector. And from our own team here at ANROWS, Celeste Koens is a research officer in the ANROWS research team. So welcome everybody. Celeste, we're going to start with you. You've co-authored the ANROWS Evaluation Quick Guides, which are available on the platform. These focus on key aspects of evaluation relevant to the violence against women sector. The guides provide an overview of key evaluation concepts, frameworks and skills. They also share different examples of evaluation and links to very useful resources. Celeste, what does success look like in the evaluation of a domestic and family violence intervention? How might this have different meanings amongst different stakeholders within a project?
Thank you, Michelle. I'd also like to acknowledge that I'm joining this call from the unceded Gadigal land here in Sydney, and I'd like to pay my respects to their elders past, present and emerging. Defining success in evaluation in this sector can be quite dependent on the type of project that you're working on. So success for a primary prevention project would be quite different compared to a perpetrator intervention or evaluation in a frontline service. We have a wonderful panel here today who have expertise across all of those spaces and workplaces, who I'm sure will provide a lot more information on that throughout the course of this evaluation. However, speaking more generally, when we undertake evaluations, you'd want to think about the purpose of your evaluation. Are you interested in success in terms of the process of implementing the program? Or are you interested in success in terms of the impact of the program? To this end, you might want to consider what the intended aims and outcomes of the program are, what the needs of the program or service is, what the needs of the participants or clients are, what the specific requirements of the funder may be, and you may also want to consider the processes that are undertaken in the delivery of the program. So different stakeholders will have different information needs from the evaluation. For example, a funder may want you to show through your evaluation that the program is being implemented as intended. So for this, they may want you to do a process evaluation. They may want you to quantify the reach or the cost effectiveness of the program. So you might consider doing a cost benefit analysis or tracking the number of people who are participating in the program throughout the course of a number of years. They may also want you to demonstrate that the intended impact is being achieved. So this would be done through an impact evaluation. A service provider may also be looking for evidence that the program is reaching the intended audience and having the intended outcomes. They would want you to make sure that there's client satisfaction with the program and look for ways that the program or project could be improved. And these can all be done through various evaluation methods. Within the sector, we also want to centre victim and survivors' voices when we define success. For clients and participants in a program, a successful project could focus around any number of things. They might focus on easy access of the program or service. They may want increased knowledge or changed practices or an increased sense of safety as a result of participating in the program. In the domestic and family violence sector, services may also be particularly attuned to the need for cultural safety and trauma-informed approaches, which may inform their definition of a successful program. I really want to reiterate that so much can be learnt through client and participant-informed programs and evaluations. Centering survivors' voices is really important, and I think the rest of our panelists today will speak to that as well. It's really crucial to include their voices when you define success of a program.
Great, thanks, Celeste. And I do encourage all of our viewers and participants to look at the evaluation quick guides, which are on the platform and of course on the website. Rodney, could you maybe just a quick comment from you on what success looks like when evaluating perpetrator intervention programs, and how are the outcomes understood and measured?
Thank you, Michelle, and I'll respond to that acknowledging that I'm on Wurundjeri land as part of the Kulin Nation. I was born on the Whadjuk land with the Noongar people out west. Pay my respects to all elders, past, present and emerging, and acknowledge this is still stolen land, and for a non-Aboriginal person there is a lot for me, my family and others to do to recognise what the continuing occupation of Indigenous lands mean, and the very least, the very least, what we need to do to pay the rent and to encourage a better response to now over 440 Aboriginal deaths in custody over the last less than 30 years. So in some ways, I think responding to what success means in interventions that work with people who cause family violence harm is no different than what success means in other family and domestic violence interventions. Ultimately, long-term, ultimate outcomes, ultimate success is safety, well-being and liberation of women and children and others who are experiencing family violence. I think those long-term outcomes and centering success in those long-term outcomes is critical. You know, what difference do women, children and others need from a service system for their lives to be better, for their lives to be safer, for them to feel they have more control, more autonomy, for our communities to feel that there is a healing, for communities to feel that they're more able to grapple with the violence that is tearing those communities apart, in part because of colonisation. So I think perpetrator interventions are no different from other sorts of interventions in terms of those long-term outcomes. I think what is different is the importance of thinking of the multiple pathways that can work towards those long-term outcomes. And often, when we think of perpetrator interventions, we may just think of behaviour change outcomes. We may immediately just focus on, is he changing? Is he a safer man, a safer father, a safer partner for his family? Is he a safer man for his community? And while that's obviously a very important outcome, I think if we just consider success only in those terms, is he changing his behaviour, we miss the other ways in which these programs and interventions work towards that ultimate aim that we've all been talking about. So he may not be changing his behaviour, however, through the intervention, is risk lowering in the short to medium term. Are the service system responding to him in a more accountable way? Do the variety of different agencies and members of his community know more about its patterns of harm and the impacts of those patterns on family members? Is he being held accountable for that harm? Is because of the ways in which perpetrator interventions are engaging with him, do we all now understand more about the unique experiences that his family are experiencing? Are we able to put themselves more in his shoes because we understand his patterns of coercive control better? Are we able to interrupt potential upcoming ways in which he might be using violence? So I think success not only means is he changing his behaviour, success not only means is he being a safer dad or a safer partner to be around, it also means is the service system better able to understand risk. Is a service system better able to understand the patterns of harm and work with him to be accountable? Is a service system allying and working and advocating for his partners and his families and his children's needs more effectively because we now understand more about his patterns of behaviour? Are we able to keep him more in view and interrupt his opportunities and inclinations to use violence? So success means all of those things. And obviously, as we'll talk about later in this webinar, one of the tricky things is for our evaluation methodologies to be able to shine a light on these pathways rather than just focusing on the one question, has he changed?
Thanks, Rodney. And bringing that integrated service system response back into the picture, it's a great segue to you, Cecilia. You're from Respect Victoria, a state government organisation which is dedicated to primary prevention in Victoria. From your perspective, can you tell us about why evaluation in the primary prevention of the violence against women sector is important?
Thanks, Michelle. And firstly, thanks for the invitation to be on the panel today. I'm really delighted to be here with my other panellists. Before I start, I too would also like to acknowledge the First Nation peoples and traditional owners and custodians of the lands that we're meeting from. For myself, like you, Rodney, I'm on Wurundjeri land from the Kulin Nation, and I pay my respects to elders past, present and emerging, and recognise that our First Peoples sovereignty was never ceded, and that in fact all government policies, programs, services here in Victoria are all being delivered on Aboriginal ancestral lands. So good question, Michelle. I think, as we are all aware, well aware, violence against women and family violence is rife, it's complex and it's extremely pervasive. And there's no single cause, no single solution, and that all of these factors are multifaceted and interrelated, and they're interplaying at all different kind of levels of society, which in many ways is why evaluation is so critical. We also know that, the international evidence tells us that the particular expressions of gender inequality in society consistently predicts higher levels of men's violence against women. So this is something that the sector has known for a very, very, very long time. And it wasn't really until the Royal Commission into Family Violence that government really started to understand, the collective understanding of the sector already, of the complexity and the sheer scale of the issue in our community. So the primary prevention work is the remit of Respect Victoria, which you mentioned. It involves addressing the underlying gendered drivers of men's violence against women to stop violence from occurring in the first place. And these are things, that they're expressed in particular ways, whether it's from condoning violence against women, through men's control of decision making and limiting independence, right through to rigid gender roles and male peer relationships. And as you know, the Victorian Government's Royal Commission led to significant investment across all tiers, from primary prevention to tertiary. And that the first ever statewide primary prevention strategy in 2018 from the Free From Violence. So this, for us, is very much around trying to join up those services and policies and knowledge and interventions in a much more coordinated way. But this is ongoing and it's complex, and which is why evaluation in our sector is so critical. And certainly, both from a practitioner's point of view and a funder's point of view and from a policy point of view. So our work on monitoring and evaluation aims to address the issues that we've seen across the prevention gaps in knowledge sharing and risk assessment, and the availability of what actually works right across the sector, and making sure that all of those who are involved in whether you're trying to prevent violence from occurring in the first instance right through to responding to where violence has occurred, all of these things through evaluation is about sharing that knowledge. And it's really important for us also to know how these activities are progressing and contributing towards our desired end outcome, or put simply, no matter how small, no matter how incremental, have our activities contributed to that end goal and been able to understand and to track that. So while we know primary prevention is a long-term game, it's a long-term effort, and you know, these things, as you all know, need to occur over a sustained period of time with significant investment. It doesn't mean that we have to wait to learn what we're doing well and where we could make better inroads. And so from a government point of view, it's really important for us, but also for all of us in the sector, to understand how we're contributing to change in the short, medium and long term. And so these sorts of ideas really resonate for myself and my team in Respect Victoria, as I'm sure they do right across the sector itself. So part of our work is about understanding those robust ways for us to identify those shorter term gains. And so through evaluation is going to give us that best line of sight to understand how we are tracking towards that end outcome that all of us are wanting to ensure, which is, you know, the reduction, or the optimal is no violence, of course, but you know, we've got certainly a long way to go there. The other then for us is really, I guess, we're thinking about for the free from violence outcomes framework as well. And anything from a sort of a gender equality measures around workforce pay gaps and precursors to behaviour change, such as insights about knowledge or awareness raising or outputs for better governance, etc. All of these things are part of that kind of primary prevention, but also in the response space, that kind of that puzzle that we're all trying to fit the pieces together. So in other words, for us, these measures really are about giving us an understanding of how our investment and initiatives in primary prevention are contributing to the means, not just the end. And while we've got a great starting point, and certainly, you know, Respect Victoria and our remit to help support capacity in growing, you know, the monitoring and evaluation effort across the sector, there's still so much more work to be done. But I think, you know, it's also worth mentioning that any comprehensive monitoring and evaluation strategies, which, you know, many of my panelists will no doubt touch on, is also really understanding both the value of the formative and also the summative. And these sorts of system insights will help us in government understand where better to invest, how better to support, and how the sector can help us inform our own thinking and our own response from a government point of view. So like everyone on this panel, I think we would all agree how critical it is that M&E is you know, undertaken in our sector, and respectively what our roles are to support each other across the sector to do this really well, because those insights will hopefully help us continue to improve, continue to enhance, and continue to make difference.
Yes, thanks, Cecilia. Exactly, and you know, bringing us back to that sort of system integration and coordination perspective is really important. And turning to you, Annika, to look at a different aspect of evaluation. When completing an evaluation, the safety of clients and staff is critical. ARC Justice is a community-based legal service. Can you talk us through how you manage ethical, safety, privacy risks in your evaluation work?
Thanks, Michelle. Great to have the opportunity to join the panel today to share a frontline service provider's experience on evaluation. I'd like to start by acknowledging that I'm joining the webinar today from Dja Dja Wurrung country here in central Victoria in Bendigo, and pay my respects to elders past, present and emerging. It's a big question. There's a lot to consider when thinking about risk, privacy, ethics, and safety in evaluation. But I think that frontline service providers have a great opportunity to approach all of these aspects of evaluation through a trauma-informed lens. Obviously, this is how we approach our work with clients, but all too often we view evaluation as, I guess, a separate process to that work. And so we don't necessarily apply that same trauma-informed lens to our work in the evaluation space, or we are, on some occasions, I guess, outsourcing some of our evaluation work occasionally to consultants or to academic partners who may not approach it with that lens either. So I think frontline service providers in this system are uniquely positioned to do evaluation safely through that trauma-informed lens. It's by no means, I guess, an exhaustive list, but I can share some examples of what that might look like on the ground based on ARC Justice's experience doing evaluation, particularly with survivors of family violence going through the family violence intervention order process. So some of the things that we have considered in our evaluation work is, I guess, who do we ask to engage in our evaluation activities, and making sure that whether it's clients or staff or other practitioners, that people are at a point in their personal journey and experience of the family violence system that they can safely reflect on their experience. So engaging with a client who's perhaps deep in an ongoing family violence intervention order matter may not be appropriate because it can be very triggering or traumatizing, and it can raise safety and privacy risks. What that means from a practical standpoint is, I think, for a lot of organisations working in the violence against women sector, evaluation work tends to need to be a little bit more qualitative than quantitative, in that we tend to work with a smaller pool of clients to understand diverse experiences rather than doing, say, broad quantitative surveys or things like that. And that's primarily because it is really critical to have that trauma-informed lens in terms of who we ask to participate in evaluations and the appropriateness of engaging with people at different points in their journey through the system. It's also important for us to, I guess, think about the questions that we're asking. And first of all, are they necessary? Are we actually going to use the information that we're gathering? And if not, we probably shouldn't be asking that question. But also, is there an alternative way of getting that information rather than asking of it directly of the client? So limiting, I guess, the burden that we place on our clients to provide us with all of the information to facilitate evaluation processes is really important, and to look at alternative sources of that information. It's also, I guess, important for us to think about the way that we ask questions too. So to give clients a voice in evaluation processes and to take a trauma-informed approach, I think we need to be conscious of asking open questions and giving people the space to give us the information that they see as most critical or relevant based on their experience, as opposed to asking very narrow, very contained sort of questions like you might see in traditional surveys or things like that. So thinking about what questions we're asking and how we're asking questions is really important. And finally, I would say, from our experience, it's been really critical in thinking about risk and safety and the well-being of both our staff who may be involved in these evaluation processes, and also our clients, to allocate plenty of time for these evaluation processes. So what that can look like, for example, is allocating additional time at the end of a client interview, for example, so that you can pause your recording and your note taking, and everyone can stop and take a breath and, I guess, reflect on some of the feelings that the conversation might have brought up. So building some of those debriefing type activities into your evaluation processes is really important from a trauma-informed perspective for clients, but also for staff. Making sure staff that are involved in evaluation are reflecting on it in their sort of supportive supervision or their reflective practice processes as well, because evaluation can leave staff exposed to vicarious experiences of trauma, or can raise things from their own personal experience as well. And giving clients the flexibility to determine when and how they engage in evaluation activities. So that might be giving the option, for example, of doing an interview over the telephone, or in person at a location that they feel safe, that they have determined. It might be breaking an interview up over a couple of days so that it's not too intensive a chunk of time and it's not too overwhelming or burdensome on the client. We've also found it really critical to check in with clients after we've engaged them in an evaluation process, so a few days after, just to see, I guess, if the evaluation activities have raised any issues or concerns for them, and as an opportunity to connect those clients into relevant support services and make supportive referrals if we need to. So not ending your engagement with evaluation participants when the activity finishes, but remaining engaged to provide support after those activities if it's needed, and also feeding back to those clients how the information that they have shared has been used to inform improvements in practice and policy and advocacy. And that's really critical because ultimately we want evaluation to be an empowering process for the staff and for the clients that are involved. And the only way we can do that is if we can demonstrate that that the individuals involved in these processes have been heard and that their voice is reflected in the outputs of our evaluation work, and it is actually informing changes and improvements in practice. So it's really critical to not forget that final step in the evaluation process, which is the feedback process. So I think applying a trauma-informed lens to our evaluation work is something that practitioners can, I guess, are uniquely well positioned to bring to evaluation. So just because it may not be your bread and butter, doesn't mean that the best option is always to outsource evaluation to sort of research experts, because I think practitioners can bring a lot to evaluation processes in terms of ensuring that the process is empowering for the clients and the staff involved.
Great, thank you. Thanks, Annika. That's been a really useful summary of very practical ways in which you have managed the issues. And from a frontline perspective. So turning to you, Celeste, as a research expert, how have you responded to a safety issue in a domestic and family violence evaluation project from your perspective, which is opposite?
Thanks, Michelle. Yeah, I'd really like to reiterate some of the things that Annika was saying, especially around safety, not only for participants and staff, but also for external evaluators. If you are engaging an external evaluator or research expert, they may not always have experience or expertise working in this sector. So trauma-informed practice might be something that you need to work really closely with them about, and also vicarious trauma, which people who work in the sector are probably very familiar with, but if you haven't been in the sector, it may not be so evident, and you may not be as aware of your risk of vicarious trauma. So in that regard, you want to make sure that there are systems in place to support evaluation staff and your project staff, as well as the participants. You want to make sure that there is formal debriefing, and there are perhaps self-care plans or discussions and encouragement about self-care before, during, and after the evaluation, so that everybody involved is staying well and healthy and their well-being is maintained. You also want to make sure that your evaluators have information about where they can get help, whether there's EAP support that they can access, or clinical supervision, or whether there's some other counselling service they can access. The other thing I really want to stress is that safety is an issue not just when you're working in a frontline service, but also in primary prevention programs. I have partnered with a lot of primary prevention programs that are looking at doing workplace capacity building, workplace focused primary prevention, gender equality programs and things like that. And one of the things that comes up quite a bit is people talking about how they were doing an interview, an evaluation interview or a focus group after a session, and found that they were getting disclosures of their colleagues' personal experiences of violence. So even though the program or the session didn't focus on people's experience of violence, it was still something that came up during the evaluation because people were treating it as almost like a debrief. And the teams that I've worked with who have experienced this have sort of reflected on the fact that you need to really ensure that there is good capacity amongst staff who are delivering the program and amongst evaluators to recognise, respond to and refer disclosures to people who can help. So awareness about where to refer people for help or how to manage these disclosures. And that is also assisted by strong workplace policies and practices around domestic violence policies and managing disclosures. The other thing that's really important when you're doing your evaluation is defining the space when you're doing face-to-face interviews or small focus groups, even in a primary prevention setting. So you want to clearly explain before you start gathering your data what it is that you're looking to ask people about. If it's not a place to talk about people's personal experiences of violence, then you need to make it really clear that in this session we're going to discuss the program that we just participated in. We want it to be a safe place for you to reflect on the program, but not to share your own experiences of violence. If you feel the need to talk to someone or if you need to get support, this is where you go for services. So defining that space and making sure that it doesn't become a space in which people are making disclosures, which can then impact the sort of personal safety and the risk of vicarious trauma for other people, is really, really important. These, I think, are also really important steps for getting informed consent before you undertake your evaluation, which is important for ethical practice. You need to make sure that your participants understand what data you're planning to collect, why you're collecting that data, what you're going to do with that data, who is going to be able to access it, whether it's going to be published publicly or whether it's just going to be an in-house resource. So these are all, I think, key factors that contribute not only to the safety of the participants, but also to the ethical practice and the integrity of your evaluation.
Thanks, Celeste. And in terms of defining spaces, I'm going to segue to you, Rodney. You're a member of the project team for the ANROWS research on the development of a best practice guide for perpetrator program evaluation. In your work and research into men's behaviour change programs, what challenges in evaluation rise in this space, and how have you been managing them?
No, thanks, Michelle. And in responding to this, I'll try to represent some of our, collective voices with Angela and Georgia, who, wrote the guide with a bit of my assistance. So I'll try to think about what some of their responses would be through to this as well too. I think one of the things that the three of us would really stress is that one of the real challenges in evaluating programs and interventions that are working with perpetrators is a program ready to be evaluated. That I guess we come across so many situations where it's a new trial, it's a new initiative. I guess in my experience in working with agencies, it can sometimes take 6 months or a year for a new initiative to really find its feet. Yet sometimes there's pressure to do an impact to an outcome evaluation from the word go, rather than spending time doing a formative or a process evaluation to look at, is a program being implemented as planned, as intended? And if not, does that mean some changes are needed? Because the act of trialling the program means that you find out more about how to make a program more effective. So I think that's one key thing that we found. Sometimes the pressure or tendency to rush to an impact to an outcome evaluation before we really know whether the program's being implemented as planned and whether it's really evaluation ready. I think other things that we'll just briefly comment upon is a tendency to still focus a lot on men's own self-reports, on in-perpetrator interventions, to have impact and outcome measures that focus on men's perspectives about whether they've changed. And of course, there can be a very strong degree of unreliability in that. Not that it's not important to capture the perpetrator's own perspectives, that can be useful, but relying upon it in order to determine whether there have actually been changes to safety, well-being and liberation of women and children, it's not a very reliable measure. So I guess that points to another common issue is how do we try to find those measures or work with women and children to evaluate measures related to their own safety, to their quality of life, to the things that matter to them. Changes in the perpetrator's patterns of coercive control that really matter to them. So that relates to, careful, patient-sensitive, qualitative research and interviewing victim survivors. It means focusing on measures that are meaningful for them, and obviously Project Morable in the UK, as well as ANROWS research and the quality of life indicators, point some directions as to where we can find some measures that are meaningful. It means thinking about success in terms of impacts on the whole of the family, family functioning, children's safety, stability and development. So the more we start to focus on measuring outcomes and evaluating perpetrator interventions from the perspective of those outcomes, we're usually talking about bigger budgets. So a key thing is how do we find realistic ways, not shortcuts, but ways that we can just add on to our existing work with women and children to start to sensitively collect some of this data. I think just finally, another challenge is to be able to evaluate enough in the long term. Often, I guess in a number of the supervision work that I'm doing now, I know a lot of frustration from practitioners who are working with men while they're not with their partners because of a protection order, etc., to try to assess their journey to become safer men. But the proof isn't in the pudding until he's back with his family. And that might be 2 or 3 months after the intervention is finished and the system's taking their eyes off the family. So that is another challenge. How do we evaluate outcomes that are meaningful for the perpetrator's family when we often don't know how much behaviour change and how much safety is being built until it does return to his family, until he's back at that point. So the evaluation practice guide points to a number of other challenges and some, I guess, suggestions and ideas to try to have workarounds to some of those barriers, but they're just a few that I thought I'd point out.
Thanks, Rodney. And that guide is also on the GoToWebinar platform for those participating. And I just thought I'd just mention that that's Angela Nicholas and Georgia Ovenden, both from the University of Melbourne, who worked with you on that one. So thank you. And I guess timing is everything, as you pointed out, Rodney. And turning to you, Annika, on the question of timing, evaluation is important and complex. And some organisations may not have funding or resources to commission independent evaluators. And you've touched on this earlier, but how can community-based organisations in the domestic and family violence sector build capacity to undertake evaluations internally? And again, that speaks to time and some of the comments you made earlier, but it's really that capacity building question is an issue.
Yeah, absolutely. I think whilst we would all like to have the budgets to fund expert researchers to do evaluations for us, that's not always possible. And also it's not always the best option. When you think back to the point that Celeste made earlier around thinking about what is the purpose of the evaluation, if it is to inform our practice and practice improvements, then it's really critical that the people delivering services are involved in the evaluation process deeply and from the design all the way through to the implementation. So building capacity within your organisation is really empowering because it enables you to move beyond, I guess, just addressing the evaluation questions that your funders ask of you to actually answering the questions that you think are important for your service to grow and be impactful and for your clients as well. So it is a challenge. For context, ARC Justice is we're a regional community-based organisation. We have around 40 staff across 3 office locations. So we're, I guess, a moderately sized community organisation. But when we started our evaluation capacity building journey, we didn't have any dedicated monitoring and evaluation staff. We had very limited money in our budgets to do evaluation work. So I think the key for organisations like us is starting small small. So don't try to do everything at once. Maybe pick one project or one program within your service to focus on, and look for opportunities to engage a broad range of staff in that evaluation process. Alternatively, you might pick one or two indicators that you're interested to track across your entire organisation and across your service. But again, keeping it small, not trying to measure everything. So for us, for example, we initially focused on our intake systems and processes because these are the entry point to our service, and we were interested in the question of accessibility and whether we were reaching the most vulnerable people in the community. So we engaged our intake teams in this process, and I think Rodney mentioned this as well. We looked at what is the information that we are already collecting that can help to inform an evaluation of access and reach in our intake space. So where there were gaps in that data, we looked at how can we embed some evaluation questions into our existing intake systems and processes. So it's not additional work, but it's embedded in processes that are already part of our intake system. So I think it's critical to look at what's already there and to not duplicate processes or sort of reinvent the wheel. And to involve staff in the process from the very beginning so that they've got a sense of what the purpose of the evaluation is, and most critically, how the data that they're collecting and generating is actually being used to inform practice. So what we've seen undertaking this process over a few years is that increasingly our staff are excited about data. They don't groan when we raise monitoring and evaluation in meetings, and taking initiative as well to improve their own sort of systems around collecting information as part of their core work. So it's a cultural shift in organisations often, capacity building around evaluation, moving from viewing it as purely about reporting and accountability to actually about understanding that the work we're doing is having its intended impact, and so I guess celebrating those wins, but also at looking at opportunities for improvement. So starting small is really key. The other thing I would say briefly is to look at opportunities for partnership and in evaluation. And this is particularly critical, I would say, for regional and rural service providers, because often you are working in a small service system where every organisation has evaluation obligations, and we are all trying to get data from the same clients and the same stakeholders. And that can put a huge burden of participation on our clients and on other people in the sector that we're trying to engage in our evaluation activities. So talking to your partners about what you're evaluating and opportunities to align that with what their evaluation needs and interests are, so that there can be sharing of information rather than duplication of efforts within the sector, but also looking at opportunities to pool the small amount of resources that each organisation has to do some collective evaluation work. So a really positive example of that I can share from the Central Goldfields Shire here in Victoria was some work done by some of the agencies involved in the local family violence action group, who developed a case study template together, and each agency went away and conducted one case study with one client where they mapped their journey through the local family violence response system and got feedback on all the different agencies that client had been involved with, and then brought that de-identified case study back to the group to share and discuss with the group. And what that enabled was each of the agencies that were involved got to receive feedback on their service from a number of clients, but only had to speak to one themselves. And it also enabled the group to look beyond their individual services to some of the gaps and opportunities for system strengthening more broadly. So I would say that capacity building is easier when we do it in partnership with others. So looking for those opportunities to partner with other service providers to either collaborate on evaluation or to at least align what you're doing and measuring, so that there's opportunities for information sharing to reduce the burden on our clients and stakeholders who we're requesting to participate in these processes.
Great, thanks Annika, and I can see lots of nods. I just quickly throw to the panel, are there any additional comments that you would like to make, Celeste or Cecilia or Rodney, in terms of building workforce capacity for evaluation? We'll go to you,
I think we're
Cecilia.
going to be polite, Rodney. I'm not sure if you wanted to jump in first.
Rodney, you're on mute, I think.
You're so right, Michelle. Yes, now I'm off mute. I'm really struck by your point, Annika, around how services already collect a lot of very useful data as it is. You know, I know, from evaluators' experiences that trying to work with agencies to collect more data than what they already do is often really, really difficult. So working with practitioners from the word go and being able to have that sort of very sensitive relationship, if there is an outside evaluator or if you are bringing in a little bit of external expertise, where you're sharing a story that's really meaningful. And I think that's often a really starting point. What practitioners often don't realise is that we've got so much to offer in evaluation because we hold the meaning. It's very easy to write a simple evaluation question, but the meaning of why it matters to clients, the meaning of the difference that you're trying to make is some really critical starting points. And so I think having that sort of collaborations with maybe evaluators with a bit of expertise can really help not only for the evaluators to understand that meaning more and to understand what the service is really looking to achieve and to understand the issues and how to engage sensitively with your clients. But I think it's not a long road to pick up some evaluation expertise. And I think often practitioners, we think of, research or evaluation, a scary thing, where really, particularly the sort of budgets we're working with and the need to keep things simple, it's not that scary actually at all.
Yeah, look, I'd really echo Rodney and your points there, Anita. I think in the primary prevention sector more specifically, like what we've heard through the Royal Commission, that in the family violence and violence against women sector, there's so many gaps in our data and in our evidence and in our knowledge, and we all face obstacles in trying to improve our insights into how government policies are faring, how programs are faring, how projects are faring. And I think, we taking your point, Annika, we need to find smart ways and opportunities to be really creative and proactive with our data collection. And this is without saying, privacy protections and participant safety and et cetera, all of that is an absolute given. But in thinking about how we can share some of the data and the insights that we are collecting in the primary prevention space, and also just more broadly, and finding those sorts of ways of connecting up, because at the end of the day, what we're all trying to sort of collectively understand is what does our shared success look like across all of these different domains, and how are we all measuring our progress against this so that we can really prioritize those things that are really working well and look at how we ensure those activities and the relationship that we have with them and the contribution to that shared state, how we can do that together as a collection, as opposed to, program A is operating over here and program, Y is operating over here, and never shall the twine meet. And I think, what we know also out of the review is that, the need to connect the dots, the need for us to be working in a much more interrelated way. And I think through M&E, through monitoring and evaluation, gives us a really good opportunity to do that in lots of different ways.
Thanks, Cecilia. Celeste, I'll throw to you very briefly, but if there was no comment, we'll move to questions. Did you want to add to the building of workforce capacity? I know you've done work in this area.
I'll just briefly mention, I hear a lot of people saying we don't have resources, we don't have time to do evaluation. And I think all of the panelists have touched on this. To a certain extent, everyone's collecting data in some sense. Evaluation is almost like a process of reflecting and learning. And I think all of the services that work in this sector undertake that process, whether consciously or not. And so I would encourage organizations to build a way to just formally document that process. What are they doing? What are they reflecting on? Take notes, keep notes. That will help with their evaluation. And that's something that can be done from the planning phase. So from the very beginning of your project, think about how you're going to document that process of learning and that process of reflection.
Great summary. Thanks, Celeste. Okay, we've got lots of questions, so I'm going to spend the next 10 minutes or so on questions before we sum up. I think we've had a fantastic contribution from the panel in terms of both the strategic and the practical advice around conducting evaluations. I'll throw to a specific question. We have touched on this, and it might be something that Annika and Rodney want to address. How can we best ensure that evaluation includes client-consumer participation throughout the process?
Rodney, do you want to jump in first?
Sure. Just briefly, I think qualitative research has already been touched upon. I think Celeste and Annika and Cecilia, I think you've all been emphasising that before trying to collect quantitative data, often start off by having, culturally appropriate ways and safe conversations to help to tease out patterns, to help to sharpen what our research questions are, to hear experiences of our clients. I think that's really a critical part of this. I think also asking ourselves, how will the evaluation be meaningful for clients? And we're not going to know that until we ask and involve them and talk about our plans and what would make it meaningful for you and, say, for other victim survivors to participate in interviews. What would be meaningful for you to retell some of your story or to have a conversation that, will impact. I think we can sometimes worry that, got to be so careful around any sort of evaluation activity with victim survivors because we're going to immediately trigger stuff. And yes, of course, we've got to be incredibly careful around that. But at the same time, these can be real opportunities for victim survivors to contribute and to be able to be a part of something that's meaningful for them. So I think having curious and open questions about how will it be meaningful, how do we sensitively involve people who are conducting the evaluation with right from the start, so that it's not just brought in later, but it's part of focusing on the evaluation questions and what we're trying to get out of it.
Thanks, Rodney. You covered this quite well before, Annika. Was there anything that you wanted just to reiterate?
I guess just briefly, I would echo exactly what Rodney has said around thinking about the entire evaluation process from design through to implementation and sort of reporting or the outputs of the evaluation and opportunities to engage people with lived experience throughout that process rather than just as participants in a sort of extractive way, which is unfortunately how a lot of evaluation is done. I think in terms of voice, just reiterating a point I made earlier around that final stage of the evaluation process as well in terms of the outputs and making sure that often the outputs we produce from evaluation are for a specific audience, and typically that audience is not the participants or not the people with lived experience, it's policymakers, it's our program funders, it's other stakeholders. So making sure that as well as involving people with lived experience in the evaluation process, that there are outputs designed for them as well that are accessible and again empowering and show that how that voice that they've contributed to the process has been heard. So I think thinking about the outputs for research participants as well is really critical, and unfortunately it's often a missed step.
Yeah. Thank you. Great. I'm going to go to the second question, and this word's come up a lot today, but we haven't really explored it. You have in part, Rodney. What is the best way to evaluate impact when we know reporting of violence is low? Increased reporting could be a positive thing. Who would like to start with that? Celeste, would you?
Yeah, I think that sort of goes back to having a sort of broad definition of success that centres survivors' voices. So yes, increased reporting could be a positive thing because it could demonstrate that there's more understanding of where to report and where to get help. And that's what you want from a lot of programs and projects. So I think it's also a matter of understanding what has led to that outcome and whether that's what we want it to do or not what we want. So setting really realistic expectations, having survivors' voices centred in the definition of success, and also explaining what the outcomes are, being able to look at the whole process from your individual project to the sort of larger scale outcome that we're identifying, and identify what's contributing to that and why.
Were there any other comments around impact?
Sorry, Rodney. You guys think I was... Sorry, I'll be really quick. I think, you know, in listening to the panel members today, and also, you know, just your answer there, Celeste, I think it goes back to the point we were talking about earlier, which is around kind of joining the dots. So, you know, in the evaluation space, when we are finding some of these things, sometimes there are unintended consequences or benefits that we identify as part of our evaluation activities. And this example of raised awareness leading to greater reporting is, you know, absolutely that could be a positive thing. And you know, if I you know, I do have the government hat on, and I'm sitting here with that lens, you know, the kind of the joining the dots. So if things are occurring here, which perhaps are in the prevention space, but by its very nature, it's raising awareness, and hopefully, you know, it's encouraging the sense of safety so that women can start reporting more. You know, there are flow-on effects from that, which are, you know, does have consequences for those in the prevention space upstream. And so being able for us as a sector to connect those and to see how each of our work, even at the micro level, mapping up into the macro level, that is about understanding what are we doing collectively across the sector. So, you know, certainly from a policy point of view, I think those are great things that we need to understand, and so that we can assist all of us across the sector to connect those dots.
Absolutely. Any final comments from Rodney or Annika?
I think I'll just really very, very briefly say that from a methodology point of view, that can include, Cecilia, in a program logic, having a systems level. What is the intended impacts of the intervention on the system, including police, child protection, court responses. So if we look that way, then we can start to map and anticipate increased reporting as different aspects of the system work better because of the intervention. And it also strikes to the importance of case studies, qualitative information, teasing out patterns so that we can help to make sense of some of these unintended negative and positive consequences.
And Annika, from a front perspective or a response perspective?
I think maybe just going back to the point earlier around the opportunity for collaborative evaluation and partnership work, I think Cecilia is absolutely right, and often I think what we see in the service delivery space is that often the impacts that we're seeking to achieve will actually be felt in, say, the primary prevention space, or vice versa. Activities happening in the primary prevention space, the impact of that may actually be felt in the response space as well. So when thinking about partnering on evaluation, working with stakeholders across that spectrum from primary prevention to early intervention and sort of tertiary response is really critical, because that is, as Cecilia says, all of that is part of telling a bigger picture story where we can join the dots and see, you know, it's a complex, we're working in a complex environment. There's attribution of, you know, one program leading to one particular outcome is not clear or straightforward. So needing to paint that picture together is important. And that's why I think, as well as participatory data collection activities, participatory analysis is very important as well. So having workshops, like sense-making workshops with a range of different stakeholders to help interpret what you're seeing, because people may interpret that, you know, reporting numbers are a great example in that depending on who you ask, the interpretation will be very different about what that means and what might be contributing to that trend. So I'd say, you know, if I could sort of leave with any one message, it would be taking a partnership approach across the evaluation spectrum and across the primary prevention through to tertiary response spectrum as well.
Great, thank you. I think that's a great summary, and I think everyone, you know, all of us and most people viewing would find this incredibly useful information, as we are all, you know, partaking in evaluation in some way. So I'd like to thank the panel for your time and your expertise and for sharing that today in such a professional and accessible way. Before I go, I'd also like to talk to the audience, particularly those who are interested in starting an evaluation project that they plan to publish, who already might be undertaking a research project, that ANROWS has a register of active research, otherwise known as the RA, on the ANROWS website, and this is a centralised and publicly available database of any and all current research, including evaluations in the domestic and family violence sector. And it enables both researchers and research funders to identify evidence gaps and also assist in future and policy change across the sector. So it is one way of engaging where you are undertaking a research project at this point in time. Completed research is obviously not the place for the register that automatically goes into the ANROWS library. So if you are interested in engaging and letting us know about your research, the RA, or the Register of Active Research, is on the ANROWS website. This works in combination with the ANRA, which is the National Research Agenda for Violence Against Women. Excuse me, I've got something in my throat. It's very smoky in Sydney today, so we're all sort of suffering a little bit. And the ANRA outlines the 5 research priorities nationally, which are guiding both engagement and investment across the violence against women research sector. Those 5 areas include children and young people, which is the one that is guiding ANROWS's current research program. Understanding the intersecting drivers of violence against women, sexual violence and harassment, what works to prevent violence against women, and what works in responding to violence against women. So if your research covers any of those areas, the RA is definitely the place for you to register it. Don't forget to download the resources, both the guide that Rodney has authored with Georgia and Angela, and also the evaluation guides that Celeste has authored with Peter Innes from ANROWS. Thanks everybody. See you again. Bye.